Hi to our new followers, let me introduce myself. I'm Eithne. I've been a medical doctor for 36 years and absolutely love it, and I have a keen interest in women's health. I work full-time in aesthetic medicine based in Dublin. I see about 90% women and about 10% men, and I'm using my background of the medical skills with safety, with artistic skills to help people protect their skin and reduce some of the negative signs of things like acne and rosacea and injury and scarring, and also reduce some of the changes that happen as time passes, like sagging and skin damage and sun damage. It's not about chasing lines and wrinkles, it's about very subtle changes. They're completely optional, and if somebody's interested in them, that's fine. If they're not, equally, that's fine too. I am from Waterford originally, so I've got my blue up the data. I did my medical training for 7 years in Cork, and I qualified in 1989. I mean, we barely had penicillin then. And I went to the north of England and did 5 years GP training. I took a year out. Judy, my mum, was terminally ill at the time, and I spent a year looking after her, which was really precious. I went back to the UK, and then I worked as a full-time GP in London for 10 years. Loved that. I was married to a guy a year ahead of me in college, and we're on great terms. We separated when our kids were 6 and 9, and now those kids are 27 and 30, and they're two lovely, big, gentle, tall guys. I went back to work with my ex-husband during COVID as a GP, as it was such a strange time, wasn't it? So after I worked in London, one incident that triggered my return home was I had a very serious GBH assault at work from a patient, and I moved back home to Waterford in 2004. I worked as a GP for other practices, and I did quite a bit of work in a sexual assault unit in Arkeen Hospital. And then I started my own GP practice. We had a great team. In about 2007, I heard about botulinum toxin treatment, and I started doing research. More and more studies, lots of courses, absolutely became hooked. So for several years, I combined aesthetic medicine and GP work. And then I came to a crossroads where I felt I needed to really dedicate all my time to one. And I picked the aesthetic medicine. And that was after 25 years full-time GP. So I now work full-time in aesthetic medicine. I do a lot of teaching, absolutely love it. I love seeing people and hearing their stories. We tend to see a small number of people. We're not a rush in and rush out type of clinic. We like the quality interactions and the time, and it's such a lovely area to work in. I'm really happy to do any video topics. I can't answer individual medical queries. We're not insured, or it's not really safe to do so because there's just so many variables in every person's history. But I'm very happy if you want to suggest video topics, and look forward to interacting with you. Take care. Bye.